Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking about Hospital Acute Inpatient Services Payment System. Let's dive right in. Section 1886D of the Social Security Act, or the Act, sets forth a system of payment for the operating costs of acute care hospital inpatient stays under Medicare Part A based on prospectively set rates. This payment system is referred to as the Inpatient Prospective Payment System, or IPPS. Under the Inpatient Prospective Payment System, or IPPS, each case is categorized into a diagnosis-related group, or DRG. Each DRG has a payment weight assigned to it based on the average resources used to treat Medicare patients in that DRG. The base payment rate is divided into a labor-related and non-labor share. The labor-related share is adjusted by the wage index applicable to the area where the hospital is located, and if the hospital is located in Alaska or Hawaii, the non-labor share is adjusted by a cost of living adjustment factor. This base payment rate is multiplied by the DRG relative weight. Now I will talk about indirect medical education, or IME adjustment. If the hospital is an approved teaching hospital, it receives a percentage add-on payment for each case paid through IPPS. This add-on, known as the indirect medical education or IME adjustment, varies depending on the ratio of residents to beds under the Inpatient Prospective Payment System, or IPPS, for operating costs, and according to the ratio of residents to average daily census under the IPPS for capital costs. Now I will talk about another add-on payment known as Disproportionate Share Hospital, or DSH adjustment. If the hospital treats a high percentage of low-income patients, it receives a percentage add-on payment applied to the DRG adjusted base payment rate. This add-on, known as the Disproportionate Share Hospital, or DSH adjustment, provides for a percentage increase in Medicare payment for hospitals that qualify under either of two statutory formulas designed to identify hospitals that serve a disproportionate share of low-income patients. For qualifying hospitals, the amount of this adjustment may vary based on the outcome of the statutory calculation. Transfer policy to counter hospitals' financial incentives to reduce their inpatient costs by moving some services to another setting. Medicare reduces the Medicare Severity Diagnosis Related Group, or MSDRG payments when patients have a length of stay at least 1 day less than the geometric mean length of stay for MSDRG and are either transferred to another hospital covered by the Inpatient Prospective Payment System or designated as a critical access hospital, or for certain DRGs discharged to a post-acute care setting. Under this policy, transferring hospitals are paid a per diem rate rather than the full MSDRG payment. Generally, hospitals receive twice the per diem rate for the first day and the per diem rate for each additional day. An exception exists for certain MSDRGs with high first day costs. These transfer cases are paid half the full MSDRG payment plus one per diem payment and half the per diem rate for subsequent days. New technology payments. Hospitals with cases treated using certain new and expensive technologies receive add-on payments to offset the cost of these new technologies. CMS evaluates applications for new technology add-on payment, or NTAP, submitted by technology firms and others based on criteria of newness, substantial clinical improvement, and the cost of the technology exceeding MSDRG specific thresholds. Starting November 2020, CMS also created a new COVID-19 treatments add-on payment, or NCTAP. COVID-19 treatments authorized by the FDA for which the hospital's cost exceeds the otherwise applicable Inpatient Prospective Payment System operating payment including the 20% increase for COVID-19 stays, receive an add-on payment. Outlier payment. For particular cases that are unusually costly, known as outlier cases, the IPPS or Inpatient Prospective Payment System payment is increased. This additional payment is designed to protect the hospital from large financial losses due to unusually expensive cases. Any outlier payment due is added to the DRG adjusted base payment rate plus any DSH or IME adjustments. Special payments for rural or isolated hospitals. Sole Community Hospital payments. The Sole Community Hospital or SCH designation is for hospitals that are located at least 35 miles from the nearest short-term acute care hospital or that are located in a rural area and meet criteria related to isolation. Medicare-dependent hospital payments. The Medicare-dependent hospital or MDH program is for small rural hospitals not designated as a SCH in which Medicare patients comprise at least 60% of their admissions or patient days. Low volume hospital payments. The low volume hospital designation is for hospitals that have a low number of discharges and meet criteria related to isolation. For fiscal year 2022, to be eligible, a hospital must have fewer than 3,800 total discharges and be located more than 15 road miles from the nearest hospital, excluding critical access hospitals and Indian Health Service hospitals. Now I will talk about quality incentive payment and penalties. First one on the list is access readmissions penalty. The program supports the Centers for Medicare and Medicaid Services or CMS's goal of improving health care for Americans by linking payment to the quality of hospital care. CMS includes readmission measures for specific conditions or procedures that significantly affect the lives of many Medicare patients. The maximum payment reduction is 3%. Value-based incentive payments. Hospitals are paid for inpatient acute care services based on the quality of care as evaluated using a selected set of quality and cost measures, not just quantity of the services they provide. Hospital Acquired Conditions Penalty. Under the Hospital Acquired Condition Reduction Program, hospitals are ranked on their total rate of preventable conditions such as falls, surgical site infections, and catheter-associated urinary tract infections. The 25% of hospitals with the highest rates of preventable conditions receive a 1% reduction in all inpatient payments. This is it for today. Thank you for joining me. If you found this information useful, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.